Thank you for joining me today, Dr. Pertile.
Thank you. It's a great pleasure.
So, what are the main takeaway points from the two courses that you will be covering at EURETINA?
We are going to present two courses. One is about high myopic eyes and the critical points of the treatment of high myopic eyes. In particular, the course will cover the treatment of myopic foveous cases. And the important point is what should we tell the patient to advise the operation or try to wait, so which are the risks of the operation. And then we are going to speak about macular holes in myopic eyes. This is a difficult to treat disease. And then finally, the combination of retinal detachment and high myopic eyes and macular holes. So these are, I think, very interesting topics of our everyday life, and we have distinguished speakers for this topic, Dr. Tayadoni, Dr. Garcia Rumi, and two colleagues from my department, Dr. Maggio and Dr. Mete. And so I think it's going to be very, very interesting. The second course is about a quite, let me say, rare disease somehow. The treatment of a foreign body, intraocular foreign body. Fortunately, nowadays, it doesn't happen so often that we have patients with an intraocular foreign body, especially at work. At work, we have a lot of safety devices to protect the eyes, but you know, especially children at home and these kind of things, it can happen. So it's not frequent, but it is very important for the prognosis to know exactly what to do. Mm-hmm. And so we are going to give some advice on how to remove the intraocular foreign body, what not to do when you remove a foreign body, when mistakes, and how to treat this pathology in children. This is a different kind of approach, and the complication. So even though it is not frequent, I think it is very interesting to follow this course, because when you have a case like this, you can take benefit of our advice.
Yes, yeah. That's really interesting. And how might the topics from your courses be applied day to day?
I think for the first one, we have really very practical advices, both regarding the approach to the patient. What is the prognosis, or what happens if you don't do the operation, and what happens if you do, which are the risks of the operation. And so I think we expect the attendees to be able to give immediate advice, immediate information to apply to their patient. Concerning the technical technique, I think there will be a lot of suggestion on how to solve difficult problems and how to approach difficult situations. So I expect to be really a practical course. Mm-hmm. And similarly also for the foreign body, as I said, it is not so frequent to do this kind of surgery. It's very important to have the right approach. So it is just something you can apply. The first case you have, you can try out our technique and our suggestions. So it's a really two practical courses, absolutely.
Mm-hmm. That sounds really interesting area. And what would you say are the future developments in these areas?
We expect we miss some things. We have limitation in what we can do up to now. And concerning myopic eyes, we would love to be able to stop the progression high myopia. There is a lot of interest in this field and some interesting developments. And so I think in the future we will learn more about high myopia, genetic influence of high myopia, and how to prevent the elongation, the abnormal elongation of the globe. On the other side, for people who already have high myopia and the complications of high myopia, I really hope in the future, probably not the near future, but we will have at our disposal regeneration therapies like stem cell transplantation, like artificial retina, to replace their diseased photoreceptors, because quite often these patients end up with a very, not very low visual acuity, but impaired visual acuity due to photoreceptor death and large trophic areas. And I think it would be very helpful if we could use regenerative therapies. Mm-hmm. Concerning the foreign body, it is a little bit different. It depends. Sometimes the prognosis is very good, while if a foreign body is very large, now you can not do so much. What has improved a lot during the last years is the possibility to replace a cosmetic reconstruction of the eye. Independent of the condition of the retina, it's very important, especially in children, but you can have a nice cosmetic reconstruction of the eye. Mm-hmm. And we have a very nice iris, artificial iris, for children or adults who lost their iris due to the trauma. And so the combination of corneal transplantation and artificial iris quite often can give back a normal aspect, even in eyes with a poor visual acuity. And so we expect even more in the future on this field.
Exciting times. And what would you like to have at your disposal to improve the lives of patients?
What I would really like to have is regeneration therapies. So stem cells like artificial retinal or drugs that can improve the vision, because sometimes surgically you have a perfect anatomic result, but the function is limited. So I would really love to have at my disposal some drugs or some therapy to improve the function of the neuroretina. Mm-hmm. So we hope in the future that we will have more of these things.
Well, it's such a, yes, it's such a rapidly advancing field that I think these things are all on their way, aren't they?
Absolutely, absolutely. It is an exciting time.
Yeah.
Really, every year there is something new and there is improvement. So even for us, it's very exciting.
Yes, yes.
Yeah, absolutely.
Okay. Great. Well, thank you so much for enlightening me on what we can expect at the conference. Really looking forward to it now. And I really appreciate your time. So
thank you very much.
Thank you.
Very kind of you.
And have a great time.
I enjoyed this virtual meeting, even though it had been live, but we will try to enjoy the virtual meeting as well.
Yes, it will be a bit different this one, but yes. Okay, well, thank you again.